It's antiviral, it's antibacterial, it's pain relieving, and it heals joints and relieves overall body pain. Stay tuned because today I'm going to talk about one of my favorite treatments all around. Hi, I'm Dr. Angela Yeagley. Welcome to Sage TV. Super excited today. I am revisiting a topic that Dr. Anastasia Jones, who was in our practice for a long time, and I first started with this topic on ozone many years ago, and I'd like to revisit it because it's honestly one of my favorite therapies, and you're going to find out why after I'm done with this. So I really want to dive into the many treatment uses of ozone therapy. First, I should just talk just briefly about what it is. So quick history, Tesla is the original person who developed this treatment. It fell out of use in the early 1900s, then it came back in the 1940s throughout Europe and is now available in Europe in a lot of their standard medical centers and also available as a medical treatment in 40 different countries around the world, so including the US. It came back in the US probably in the late 70s, early 80s, and has been used here as a therapy ever since. But really here, it's still more of an alternative therapy, used a lot though by a lot of integrative and functional medicine doctors and naturopathic doctors, of course. Ozone is a type of oxygen. Essentially, it's O3, and what we've discovered and what's been researched, there are probably thousands of clinical trials now on ozone therapy for many different uses, is that it has many different functions once it enters the body. You can basically put it anywhere, and literally anywhere, in places that people don't often want to put it, but it is a therapy that I'll talk about. You just can't breathe it in. That's the only thing you can't do. So how does it work? Why would you want to get it? So starting out, when we add this oxygen therapy to your treatment, it's pain relieving. It really boosts antioxidants in your body and growth factors, and that correlates with actually repairing your tissues. So again, that's part of the connective tissue repair. It increases your ATP production, but also NAD, some of your energy molecules, and then improving cellular energy, so affects the mitochondria, the little powerhouses in our cells, and even impacts and heals DNA, like the little tail. It's called a telomere, and in some of the studies it has been associated with anti-aging, but they're still working on that. And then antimicrobial, and I have a couple cool stories around this. So starting out, we use it as an antiviral therapy. That could be for an acute infection. So there is a patient that came in, and I've done this many times now, but she had broken out with shingles, and it was all around her eye. It's really a dangerous place to have it because it can blind you if it's not treated appropriately. She had done all of the standard. She was on the medications as standard medicine would direct and what we would do as well. But she was afraid, which makes sense. And so we did one treatment, one blood ozone treatment, what's called EH, and essentially it was gone the next day. I was like, that's not even what I was expecting. I knew it was going to improve, but it was incredible, and I've seen that happen again and again. We also use it for chronic viral reactivation. So if you're one of our patients, it's very possible we've diagnosed you with chronic Epstein-Barr, chronic cytomegalovirus, and those viruses, because they're in the herpes family, will live in your body for the rest of your life, and they'll sometimes wreak a little havoc. They'll make you tired. They sometimes can get high if you're stressed. We use this as a therapy many times over. We'll treat you for a period, maybe of 2 months, and it's really cool because the energy rises, and then we watch those viral numbers drop, which is great, and people feel so much better. Next is antibacterial, just as an example. So you really can use it anywhere. You can use it topically as an antibacterial, internally. I had a person come in with diverticulitis. Again, that's the infection of the intestines, and was already on antibiotics, had been on repeat antibiotics. It was not resolving, and so was currently still on them. We did a few treatments, and essentially it knocked out the infection. So that again was through the blood. It was called again the MAH, and so it goes everywhere. It got into the intestines and helped to deal with that infection. And also I'm sure it helped that the immune system was improved as well. And this is a really cool story. So skin infections. A colleague of mine who was at one of the ozone trainings, one of the extensive ones, she works at a practice on the East Coast, and they ended up getting a young gentleman who had a staph infection in his foot that he ignored. He was 27. It spread. It got so bad it turned gangrenous. So essentially the foot was dying. None of the IV antibiotics were working, and so he was scheduled for amputation. And so he came to their clinic just as a last resort. Please help me. I'm 27. I don't want to lose my foot. And so they just did intensive IV ozone. They also bagged it. You can surround it. It's called limb bagging. It's a little weird. They just pumped ozone through that. And what's crazy, within 3 weeks, his foot was completely normal and was able to avoid foot amputation. She showed me all the pictures. It was crazy. Obviously, that's a very special situation. Hopefully you're not experiencing that. But it just shows you the power of what this can do. So detoxification, this is a really cool thing that most people don't think about. So this, when we're talking about detoxing, when I see people, many times people come to us when they have been maybe sick for a long time and they've been through a lot of different specialists and things are managed, but maybe they're still in a lot of pain or they don't feel very well, their body hurt. And so we'll see that in fibromyalgia, in chronic toxicity like mold toxicity, or just keep getting chronic infections. And what's really cool, so I have a person who has all of these things. She has all of them somehow, and she feels horrible, like it's awful. And nothing, even some of the other things we were trying, and they were helping a little bit, like high dose IV nutrients, still love it. But I added ozone. I was like, okay, I think it's time. We need to pull out the big guns. And what is amazing is at first we'll have people have die-off reactions. That can be common. So you feel a little worse for the first couple of treatments. And for the first time in 25 years, she is finally, oh my gosh, I can get out of bed in the morning. My pain is so much better. I'm actually sweating for almost the first time in my life, which shows us the detox pathways are moving. And she's like, this is the first season I haven't gotten sick. Everybody in my family was sick. I did not get sick at all. And she's like, I'm always the person who catches everything. So it's been really cool watching this transformation of just moving things out of her body. Okay, so specific joint pain is next. So the neat thing about ozone as well, not going beyond the pain relieving aspect. If I put it into a joint or an area, immediately many times people will be like, oh, it feels a lot better. And part of that's healing and part of that it just relieves pain. But what's really cool is that when we target like a knee or a shoulder, or I can directly inject it and it starts regenerating or healing the tissue, the connective tissue. And so sometimes we'll pair it with, we like to do PRP, which is platelet-rich plasma, which is also a really awesome therapy. We'll put the two together, the ozone for the injection for the knee or the joint. So love it. And then next is just like it's a fantastic therapy if you have we call it multi-joint pain, but basically pain in many different joints. And cool story around that, I had it's an elderly woman, amazing, basically severe arthritis in every single joint, like from top to bottom. And she was being managed with opioids or significant pain meds. And it took till the third or fourth treatment, and she was already talking with her pain doctor about reducing her meds, walking, more energy, and it just kept getting better like as we went along. So you would expect, okay, this woman is 82, how much change can you get? And we still were able to push healing and get her pain relief and get her feeling better. And then just going into, if you have deeper, like a kind of a big tendonitis or something that is deeper, bursitis tend to be hard to resolve. We can do it systemically and it works really well, or directly inject around the area. And sometimes we'll do that with trigger point as well, so the lidocaine or procaine. So lastly, is this for you, basically? Would you be able to have this if you wanted? We do have to screen, and so there are a few labs we have to do. So we have to check your G6PD, and that's just an enzyme. It's extremely rare, but if you don't have enough of this and you do the therapy, it could kill you. So we screen for that first. And then making sure you don't have high iron. So high iron, if you do, because iron, when it's elevated in your body, it creates an oxidative state, so it's a damaging state. And so if you add ozone, which is also an oxidative therapy, it's not a good combination. And so what you have to do is you drain the blood therapeutically and you get it out of the body, and then it takes the iron with it, and then you can give ozone, and then it's fine. It's great. And then just low platelets, so because there is a little blood thinner in the treatment, you don't have to do it if you're using a small amount, but many times if we're using a large amount of blood, you have to add a little heparin, which will temporarily thin the blood a little bit. So we just are cautious about that. And that can all be done really quickly, simple blood draw here at the clinic. So then what would you expect, right? How much treatment would you need to receive? And that would depend on what you're experiencing right now, how long it's been going on, and how severe it is. I would say standard treatment, say if we have something, an acute viral infection, it might just be one. If you are dealing with chronic pain over time, you might be thinking, but it's on the mild or moderate side, it could be 3 treatments. if something is very severe and it's been happening a long time, we might be looking at around over a period of a few months. So that is it. Please reach out if you think this sounds good to you or you're interested in learning more. I would love to hear from you. So thank you for joining me, and I'll see you next time.